the truth is, I want to be completely honest here, there is no perfect, painless silver bullet out there that solves every problem, gives everybody perfect health care for free. There isn't. You know, I wish it was. I wish there was. I wish I could just say, you know what, we're going to change the system. Everybody will get as much care as they want, anytime they want. Everybody will have it, and it won't cost anything. And doctors will be happy, and nurses will be happy, hospitals will be happy, insurance companies will still make a lot of profits, drug companies will be able to charge as much as they want. I can't do it. Nobody can. What I can do is try to sort through what are all the options available, be realistic about where we're going on health care, say to myself, if we keep on doing what we're doing, we are in a world of hurt. We can't afford what we're doing right now. More people are going to lose health insurance. More employers are going to drop coverage or push more coverage onto their employees with higher premiums and higher deductibles. Medicare and Medicaid will go broke. State budgets and federal budgets will be unsustainable. And then we're going to have to make some really bad decisions where we have no good options, even worse options than we have right now. And what's going to end up happening is, mark my words, if we do nothing, at some point, Medicare in about 8 to 9 years goes into the red. Somebody mentioned it's going broke. Yeah, it is going broke. So here's what's going to happen if we don't change the delivery systems and change some of the incentives. We'll have a choice. We'll either have to cut Medicare, in which case seniors then will bear the brunt of it, or we'll have to raise taxes, which nobody likes. And we still will be paying about $5,000 to $6,000 more than any other advanced country in the world and not get better health care for it. Now, that doesn't make sense. So, in terms of misinformation, because there's no perfect solution, we can have legitimate debates about the public option that we just had. That was a good, serious debate. And you can make a plausible argument as to why we shouldn't have a public option. Now, I believe that we should, on balance. It's not perfect. It's not going to solve every problem, but I think it actually would keep the insurance companies more honest. You can have an honest disagreement with me on that. What you can't do, or you can, but you shouldn't do, is start saying things like, we want to set up death panels to pull the plug on grandma. If we could just get healthcare inflation to match the inflation on food and other items, all of our deficit, long-term deficit problems would be solved. Just that alone. If we could just reduce the amount of healthcare inflation, our long-term debt and deficit problems would be solved. So this is the most important thing we can do for deficit reduction. And I want everybody to remember that, because in this debate, you've heard a lot of people saying, we can't afford to do this because our deficits and debt are too high. The biggest driver of our deficit and debt is healthcare. When we talk about reform, you hear some opponents of reform saying that somehow we are trying to ration care or restrict the doctors that you can see, or you name it. Well, that's what's going on right now. It's just that the decisions are being made by the insurance companies. For all the scare tactics out there, what's truly scary is if we don't do anything. We will continue to see 14,000 Americans lose their health insurance every day. Premiums will continue to skyrocket, going up 3 times faster than your wages. The deficit will continue to grow because most of it is Medicare and Medicaid. Medicare will go into the red in less than a decade. And insurance companies will continue to profit by discriminating against people just because they're sick. So if you want a different future, a brighter future, I need your help. I need you to stand for hope. I need you to knock on doors. I need you to spread the word, because we are going to get this done this year.